just to go over again very quickly. So again, in males, again, we have this urethra, which we spoke about, as well as females. There is a urethra. However, specifically in males, it serves as a passageway for both. It is a part of both the. It serves as a passageway for both the reproductive system as well as for the urinary system. Therefore, it ends up serving as a passage for both semen as well as urine. It could be up to 8 inches long, the urethra, right? It passes through the prostate gland, the muscles, the deep muscles of the perineum, and then the penis. And we said there's 3 divisions to the urethra. There is the prostatic urethra, which is about 1 inch long, which passes through the prostate gland. Next, we said is the membranous urethra, also known as the intermediate urethra. And it is about 1/2 inch to 1 inch in length. And then terminally, we have the last part, the third part. When this duct passes through the corpus spongiosum of the penis, we call it the penile urethra or the spongy urethra. And this could be anywhere from 6 to 8 inches long, so anywhere from 15 to 20 centimeters. At the terminal end, this spongy urethra, it ends at the external urethral orifice, or again, the opening of the urethra, the external opening of the urethra. Okay. When we look at the spermatic cord, so this is a supporting structure, again, of the male reproductive system that ascends, that goes up, ascends out of the scrotum. And it's made up of the ductus deferens, okay, as it's going up through the scrotum, as it ascends through the scrotum. It consists of the ductus deferens. Excuse me. There's also the testicular artery. There's nerves, again, both somatic nerves as well as autonomic nerves. And even, again, you have, if you have arteries, then you're going to end up having veins. So you have veins that drain the testes as well. And again, the veins are what's going to be carrying the hormone that's produced there, testosterone, into circulation. There's going to be lymphatic vessels that are present. Along with that, we have the cremaster muscle. And again, what's wrapping all these together, we have the fascial covering. So again, this is what is termed as the spermatic cord. Okay, all these things that I just said, the muscle, the lymph, the blood vessels, the nerves, skin, all these things collectively is termed as the spermatic cord. Both the spermatic cord as well as the ilioinguinal nerve, they end up passing through a passageway, and that's called the inguinal canal. Okay? The inguinal canal is an oblique passageway that we find in the anterior abdominal wall, superior and parallel to the medial half of the inguinal ligament. It's only about 4 to 5 centimeters in length. Okay? It's about 2 inches. It originates, its origin will be the deep inguinal ring, okay? Or you can call it the abdominal ring as well. And this ring it's an opening, okay? It's a slit-like opening in the abdominal wall. Not in the abdominal wall. It's a slit-like opening in the aponeuroses of the transverse abdominis muscle. It will end at the subcutaneous inguinal ring. Okay, superficial subcutaneous inguinal ring. This is where the canal will end. So its origins are deep, right? So we have the deep inguinal ring. Okay, its termination is superficial inguinal ring or subcutaneous inguinal ring, and it's a triangle-shaped opening that we have in the that we find in the aponeurosis of the external oblique muscle. Okay, so again, between these two muscles, you have the origin as well as the ending of it. Now, in females, in women, the round ligament of the uterus and the ilioinguinal nerve, they pass through the inguinal canal. Okay? Let's see. All right. The seminal vesicles, they secrete a viscous alkaline fluid, right? And this viscous alkaline fluid, it serves. So let me ask you guys, what do you guys think? Why would there be this viscous why would there be alkaline fluid present? Anybody have? How am I going to be able to see if I can get this going? Anybody know? Nobody knows. Nobody has their hand. Oh, hold on. Okay, Glory. What's your answer?
Yes, sir. The alkaline substance is there to neutralize acid from the urine in the urethra.
Very good, excellent, perfect. So, Glory, she said its purpose is to neutralize the acidic environment. That's, well, actually for both male as well as in female reproductive. So, the vagina in women is also acidic. Okay, women's vagina is acidic, and because urine passes through the urethra in males, it will also be acidic. So this fluid is alkaline. It's therefore alkaline to help with this, to help deal with this, to neutralize that acidic environment. Otherwise, the sperm will die. They cannot survive. It's as simple as that. Very good. All right. All right. Let's keep going along then. In that case, there's no need to go further. All right. So. All right, so we had that. This is slide accessory. Okay. All right. Um, so in addition to that, in addition to secrete the fluid being alkaline, it also contains fructose. Okay, fructose is a sugar. That sugar is used for what? For ATP production. Right? Remember we said there's a series of mitochondria within the sperm cells. Well, those mitochondria, they need to produce ATP. How are they going to produce ATP? They need a fuel in order to produce that ATP. So that fuel, that raw fuel, it comes from glucose or sugar. And that sugar is fructose in this case. So again, all this fluid, the seminal vesicles, this fluid, it contains, it's alkaline, it has fructose in it, which again, this will help, this will provide it the ability to be motile and also viable to survive. And also, the other thing is, it helps the seminal vesicle, the fluid that's produced by the seminal vesicle, it will help semen coagulate after ejaculation. Okay, so this is important as well. It helps with coagulation of semen after ejaculation. The next is this, the prostate gland. Now the prostate gland, it also secretes a fluid, and it's slightly acidic fluid. Okay? Um, it's milky in color, in its color, um, and it breaks. So where we had um, the seminal fluid bringing about the property of coagulation, the prostatic fluid, it will contain enzymes that help break down those, the counteract the clotting protein. So it's a balancing act. In addition to that, there's also citric acid that's in prostatic fluid. Citric acid, it's also used for ATP production. Aside from that, there's other enzymes, proteolytic enzymes that we find. One of these proteolytic enzymes is PSA, prostate-specific antigen. That's also produced. Hepsinogen, um, lysosomes, amylase. Eventually, they end up breaking down these clotting proteins from the seminal vesicle. Um, there's something else called seminal plasmin, that's also within the prostatic fluid, and this is an antibiotic, and this helps to kill bacteria. Um, so semen, it helps kill bacteria both in the male reproductive tract as well as in the female reproductive tract, right? So again, there is benefit to this food as well. Now, the bulbourethral glands, this is the next gland that's here, the bulbourethral gland, and it also secretes an alkaline fluid. Okay? And this will help neutralize the acidic environment of both of the urethra, and also it helps lubricate the tip of the penis during sexual arousal. Okay? So bulbourethral gland, it creates this fluid that's alkaline, and it also helps lubricate the tip of the penis before intercourse, again, during sexual arousal. Okay, so again, over here you can see the ductus deferens. You see how it kind of roots over the bladder, and then it ends up joining at the junction of the start of the prostate gland. You see the seminal vesicles as well. You see the seminal duct over there, leading to the prostatic urethra. All right. From there, you can see the intermediate membranous urethra, and then finally you see the spongy urethra. You see all three layers there. You can see some of the muscles that are there as well. What else is there? Other structures we don't have over here in this one. Oh, you see the. Okay, yeah, that's about all. Well, you can see the Cowper's gland, the bulbourethral gland. You can see it. And so just tiny little glands that's just inferior to these the deep perineal muscles, the deep muscles of the perineum. Okay. Okay. So I told you before about semen. So semen is just a mixture of the sperm cells and all the fluids, the seminal fluids, right? So again, we're talking about fluids from the secretions of the seminiferous tubules, from the seminal vesicles, from the prostate gland and the bulbourethral gland. So all this is seminal fluid. Okay, when you take all these fluids and um, when you take all these fluids, this is what sperm cells need to survive and eventually to be able to fertilize an egg. All right. So the ejaculate essentially consists of seminal fluid and sperm cells. Okay? Or again, another term for that would be, well, we can go along with that. All right, so it's seminal volume, okay? The volume of semen anywhere from 2.5 to 5 mLs. Okay? And when you look at the sperm count, so anywhere from 50 to 150 million, that's a lot. 50 to 150 million sperm per ejaculation. Right? And then you look about it, about 300 million are produced daily. So despite the acidity of prostate fluid, it's slightly acidic. Semen, it is slightly alkaline. And alkalinity is, anyway, it could be up to 7.7. It ranges from between 7.2 to 7.7. Now, once it's ejaculated, that liquid semen, it'll coagulate within 5 minutes. Okay? Again, this happens due to the presence of the clotting proteins in the seminal vesicle. After about 20 minutes, between 10 to 20 minutes, that semen, it'll liquefy again. It re-liquefies. Okay? Why? Again, because that PSA and other prolytic enzymes, they start to break down that clot. All right? So again, why is there a clot in the first place and why does it liquefy? Well, there's a reason for that. Maybe you guys can understand that. You might see that on an exam. Again, your exam, make sure you're very well prepared for it. A lot of theoretical questions on your exam, most likely. Essay, so study well. Essay questions, you can expect them also. So abnormal or delayed liquefaction, there's abnormal or there is a delayed liquefaction of these clotted semen. It is going to end up making the sperms not able to move. They won't be able to, they'll be immobile. Okay? If they're immobile, then again, they're not going to be able to move through, they're not going to be able to fertilize that egg. But let's say that does not happen, then, there is the breakdown of the coagulate, then they'll be able to pass through the cervix, move through the uterus, go to the uterine tube, where the eggs are going to be waiting, and then they can go and start attempt to fertilize that egg. All right. Now, aside from the female vagina, the uterus as well. Okay, cervix, uterus. There's also fluid that the sperm cells have to kind of circumvent around. They end up being affected by the secretions of these bodies as well. And this encounters that they have is referred to as capacitation. 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 Semen prostatitis. So again, when the prostate gland becomes inflamed, again, we call it prostatitis, prostate cancer. So in men, sometimes what ends up happening is the cells in this gland, they mutate. Why it happens, again, it's anybody's guess. They're not really sure. Could be lifestyle factors. There is some genetic tendency within certain races that have a higher prevalence, but typically, again, it affects everybody nearly equally. So this is one of the reasons why men over the age of, especially over the age of 50, they need to have an annual prostate exam. Women, they end up having annual exams for their breast and cervix. Men need to have prostate exam. Um, so again, if it's caught early on, then you know you can save your life. If not, then you might die from it. It is this type of cancer. It's treatable, right? Uh, Through surgery, it's easily treatable. So you have to keep this in mind. It's very important, especially when at an advanced age, or again when you end up having a family history. It's very important to screen regularly. Moving on to the penis. Penis. This is the supporting structure of the male reproductive system, and it has the urethra. This is the passageway for ejaculate, for semen, as well as for the excretion of urine. Its shape, again, it's going to be cylindrical shape. Okay, and it consists of a root, a body, and the glans penis. The body of the penis is made up of three cylindrical masses of tissue, and each of these tissues are surrounded by a tunica albuginea. They're all surrounded by tunica albuginea. Now, there's two dorsolateral masses that are called the corpora cavernosa. Corpora cavernosa. Corpora means bodies. Cavernosa means hollow. Again, so singular would be corpus cavernosum. So the hollow bodies. There's a smaller mid-ventral mass as well, and this is called the corpus spongiosum. Corpus spongiosum. And again, this contains the spongy urethra, and it keeps it open during ejaculation. The skin and subcutaneous layer, they end up wrapping all three layers up. Right? And again, this is where what ends up containing the erectile tissue. Erectile tissue is just made up of blood sinuses. And when we talk about blood sinuses, we're talking about vascular spaces. In addition to that, they're lined by epithelial cells, and they're surrounded by smooth muscle as well as connective tissue, elastic connective tissue. So again, over here you can see the glans penis. You can see the body of the penis, and then you can see the root of the penis over here also. You can see the urethra spanning the entire length. And also you see the external urethral orifice over here. You can see the corpora cavernosa, as well as the corpus spongiosum over here. You see some of the blood vessels also that are there. Again, so within them, you end up having those sinuses. As these sinuses fill up with in this erectile tissue, the sinuses fill up with blood, it leads to an erection. All right. So that's all for male reproductive system. Now we go on to the female reproductive system. So again, what are the organs for female? There will be egg. There will be talking about not egg. I'm sorry. We're talking about the ovary. We're talking about the presence of the uterus, ovary, fallopian tube. There's the vagina, of course. There's cervix. It's present also. And that's pretty much these are some of the key players. So you can see some of these structures, and you see that the vagina, anterior to the vagina, there is the bladder. So now the bladder is separate from the birth canal, right? Let's put it that way for now. Look at these in a little bit more detail as we're moving through. Let's see if I can switch. Let me try something this a minute. It didn't work earlier. I have no idea why, but let me see if this will work. All right, now it's working. So you guys can see my pointer. So what do we have over here? Essentially, what we have is one second. What we have is this. Over here, look, this is the bladder. Okay, so this contains urine. Urine is coming out through here. This is the urethra over here, all right? Urethra is where the urine is going to be coming out from. And here's the external genitalia over here. Now, this is the birth canal, all right? This is where sperm will go up through. And then it has to go through here. And then it needs to go through this tube to reach the eggs, which are going to be stored over here, right? For fertilization, the mature eggs that are ready to be fertilized. So this is a very long passageway. And again, think about that one tiny little cell, that sperm cell, and it has a series of up to 20 or more mitochondria. Now you see why it has to have all that, because it's a very long distance that it needs to travel through. Okay, so this is the purpose for that. All right, as we move through, let's continue. All right, as we move through, what we have here is just another more photos, cross sections. Moving on to, all right, so now we start talking about the ovaries. All right, so ovaries, they're, again, so these are a pair of glands. They kind of look like an almond, okay, in their size and even in their shape as well. And again, these are the female reproductive organs or the gonads that are nearly identical to the testis. Okay, again, they are the same in terms of their function, which is what in males, testis' job was to produce gametes, and females, ovaries' job is to produce gametes as well. They also have the same embryonic origin as well. And when you kind of look at them, their shape is somewhat similar also. So the ovaries we find on two sides, and in males, the ovaries are also found on, there's a right and left lateral. There's a right testis and a left testis. So again, you find them both places. In females and in males, they both have two. The ovaries, they descend to the superior portion of the pelvic cavity during the 3rd month of development. What else is there? There's a series of ligaments that hold the ovaries in position, there's the broad ligament of the uterus, which it's a fold of the peritoneum, and it attaches to the ovaries by something that's called the mesoovarium. Okay? The mesoovarium. The ovarian ligament is going to end up anchoring the ovaries to the uterus. And there's also a suspensory ligament that attaches them to the pelvic wall. Okay? So once again, the broad ligament is going to end up attaching the ovaries by one of its subsets called the mesoovarium. The ovarian ligament is going to anchor the ovaries to the uterus, and the suspensory ligament is going to attach the ovaries to the pelvic wall. Now, each ovary has an entrance, okay? Or again, we saw this term, hilum, before as well. We've seen this term used several times. We've seen it used in the kidneys and lungs. So again, now you're seeing it used over here in the ovaries. So each ovary, it has a hilum. And again, this is the point where nerves and blood vessels are going to be entering and exiting. Okay. All right. The germinal epithelium is a layer of simple epithelium that ends up covering the surface of the ovary. The tunica albigina, this is that white capsule of dense, irregular connective tissue that's immediately deep to the germinal epithelium. So again, we saw these things in the male reproductive. Now we're seeing it again in the female. Again, guys, I told you before, it's nearly identical. Okay, its function and even the shape, it resembles somewhat. The ovarian cortex, this is a region that we find deep to the tunica albigina. It's made up of ovarian follicles, and it's surrounded by dense, irregular connective tissue. So it contains the collagen. It contains collagen fibers as well as fibroblasts cells, and these fibroblast-like cells, they're called the stromal cells. Stromal, S-T-R-O-M-A-L. The ovarian medulla, we find deep to the ovarian cortex. The border between the cortex and the medulla, it's not very clear. But when you look at the medulla, we find a lot more loosely arranged connective tissue. In addition to blood vessels, lymphatic vessels, as well as nerves. The ovarian follicles, we find them located in the ovarian cortex, and it's made up of oocytes, okay? Spelled O-O-C-Y-T-E-S, oocytes. And again, these oocytes, these are immature eggs, okay? So we find them in various stages of development. So again, in the ovarian follicles, what do we find? Oocytes. In addition to oocytes, we find the other cells that are surrounding these oocytes. These surrounding cells, when these surrounding cells form a layer, a layer around this oocytes, we call them a follicular cell. A follicular cell. Later on during development, they form several layers. So when they form several layers, they're called granulosa cells. Now, the surrounding cells, essentially their job is to nourish this oocyte that's developing. It also will start to secrete estrogen as that follicle grows bigger, gets larger. A mature follicle, or a Graafian follicle, this is a large, it's a fluid-filled follicle that's ready to pop. It's ready to rupture. And again, when it ruptures, what is it going to do? It's going to release its secondary oocyte. And this is what's referred to as ovulation. Okay? So when a graphene follicle ruptures and releases its secondary oocyte, this is what is called ovulation. Now, the corpus luteum, okay, corpus luteum, it ends up having the leftovers of that mature follicle after ovulation. Okay? The corpus luteum, it produces estrogen, relaxin, progesterone, and even inhibin. Okay? It will continue to produce these until it degenerates into scar tissue, okay, which is called corpus albicans. Corpus albicans, right? So over here you can see, look, we have this primordial follicle. From there, at this point, it turns into a primary follicle. Now this primary follicle, again, as it gets surrounded by these um, here, so you can see this primary follicle. When it starts to get surrounded by these other cells over here, this is when it starts to develop into this Maturian. Here, now you can see it over here. This mature follicle, or this graphene follicle. This is it. So all these supporting tissues, they are there. This is it. This is the payload. This is the egg. They're there to try to keep this alive. They're supporting this. In addition to that, so once this ruptures, okay, now we call this ovulation, right? Secondary oocyte now, right? When it ruptures, this is ready to get fertilized. Now this, after this happens, it turns into this corpus luteum, and this will continue to produce, again, progesterone, I told you, estrogen, inhibin, relaxin, all these get produced, right, by this corpus luteum. And then eventually it degenerates into what's called the corpus albicans and scar tissue. That's it. That's all there is. So what is this term here, oogenesis? The formation of gametes in the ovaries is what's termed oogenesis. Now, unlike spermatogenesis, spermatogenesis begins at puberty in males. Oogenesis occurs even before a female is born. Okay? This takes place even before birth. So essentially what this means is how many eggs a human female will have is already determined before she is born, before she comes into this world. All right? All right. All right, so during early fetal development, the primitive germ cells, they migrate from the yolk sac to the ovaries. Over there, these germ cells, they start to differentiate within the ovaries into what's called oogonia. Okay, oogonia. oogonia. Okay, oogonia. Singular would be oogonium. Now, the oogonia, they're diploid stem cells. Okay, they're diploid stem cells, and then they will divide mitotically to produce millions of germ cells. Before this female is born, the vast majority of these germ cells, they degenerate. Okay, they die off, and this process is called atresia. 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 Now, the few that survive, they develop into these larger cells, which are called the primary oocytes. And they will enter meiosis, meiosis 1, prophase of meiosis 1, during fetal development. Okay, so get this. They enter prophase, the first prophase of meiosis during fetal development. However, they don't complete this process of meiosis until puberty. So think about it. For up to between 9 to 12 to 15 years, the remaining process of meiosis is halted, it's stopped. Okay? Amazing. Look at the miracle in that. Moving along. So during this, this halted stage, this suspended stage of development, the primary oocyte ends up being surrounded by a single layer of these flat follicular cells. Okay, so when they're surrounded by these flat follicular cells, this structure is what we call the primordial follicle. Okay? Primordial follicle. That cortex ends up being getting surrounded. The cortex that is surrounding this follicle, it's going to have collagen fibers there. And again, this is where we find those stromal cells that I told you about. Okay, so that ovarian cortex surrounding this primordial follicle will have stromal cells. When a female is born, there's about 200,000 to maybe 2 million primary oocytes in each ovary. Okay, now pay attention to this and don't forget. When a female is born, there's up to 2 million primary oocytes, and ranges between 200,000 to 2 million primary oocytes in each ovary. Okay, 200,000 to 2 million in each. So what are we saying? Between 400,000 to 4 million in total. Now, of these, let's just go with the half of them, half the number, okay? So if there's, for example, if there's 2 million present, 400,000 of them, they're still present at puberty. So you're born with up to 2 million. Of those 2 million, 400,000 are still survive. Of these 400,000, 400 will mature and ovulate during the reproductive lifetime of that female. Okay? Out of the 400,000, only 400 eggs have the capacity to be fertilized. What else, whatever remains, they end up undergoing atrasia. All right? So compared to a male, in females, again, the reproductive capacity, it is, I guess, you can say that it's already predetermined to a certain extent as to what her likelihood will be of becoming pregnant, and possibly as well as how many children that she may be able to have, right, if she doesn't get pregnant every cycle. So, I mean, if you look at it, there's 400 eggs left, and if you don't get pregnant each year, how many eggs you end up losing? You can do the math to figure out, how many eggs you have left, what your chances of pregnancy are. And again, that is if one egg. So sometimes you get more than one egg, 2 eggs, 3 eggs may get released. So again, you end up losing more. So again, yeah, you have to make sure you pay attention to this and Understand this well. Understand this well. All right. All right. Let's take a break. We'll continue. It's 10:45. Yeah, we can take a. We start at 10 o'clock. We'll take a break. We'll continue in a little bit. All right, so let's continue with this. All right, where are we at? All right, so we talked about this. Let's go on to the next slide. Uterine tubes. All right, so what do we have over here? So there's two uterine tubes, right, which are also called the fallopian tubes. Another term for it would be oviducts. Doesn't make a difference. We find them between the folds of the broad ligaments of the uterus. And again, the job for the uterine tube is to move that secondary oocyte as well as the fertilized egg um, from the ovaries to the uterus. Okay, because it is in the uterus that development and maturation will take place of that fertilized egg, that fertilized ova. The infundibulum, again, we've seen this term before, infundibulum, um, is also an opening to the peritoneal cavity. Um, and it's going to serve as the attachment for the superior lateral angle of that uterus. And we're going to see the structures as well. Over here we have the ampulla as well as the isthmus that's present. So let's move on over here. Oh, here, perfect. So now what do we see over here? So here is an ovary over here. Okay, you can see this is that ovary over here. This is the uterine tube over here. Okay, this is the uterine tube. This is the ligament that's attaching, that's holding this ovary in place, and this ligament is called the ovarian ligament. Ovarian ligament. Okay, we have the fallopian tube over here. Again, or the uterine tube, you can call this as well. These are called the fimbriae, okay, or the finger-like projections, the fimbriae. And what these guys do is, here, let me open up. All right, so it's too much light over there. So these, I can't get this. Can you see my hand? Okay, so these guys, what they'll do is they kind of do one of these things. These fallopian tubes over here, I'm sorry, the fimbriae, they're kind of, what they're trying to do is they're trying to suck in that egg, okay? So as they're moving about like that, they're trying to get that egg to come in, and then once the egg is in, then it ends up being, it's gonna end up waiting around. Eventually ends up being, once it's fertilized, it will end up being transported, and it will attach to the wall of this uterus over here, okay? So that is the job for that, for this structure. Now, let's move along. Okay. Another cross section of that, and then we get down to the layers of the uterine tube. Right. So, what are the different layers of the uterine tubes? Again, very simple, simplistically. Again, we've seen this before. Also, there's a mucosa layer. So there's a mucosa. There's a muscular layer called the muscularis, and then there's the serosa. Okay, serosa, muscularis, and the mucosa. These will be the three layers for that. Again, over here you can see some of these ciliated columnar epithelial cells. There's also these non-ciliated cells, which are called the PEG cells that we have of the uterine tube over here. After ovulation, okay, up to 24 hours afterwards, this is when fertilization can take place. Okay, so usually about 24 hours after ovulation, fertilization is possible. Hours after that sperm is able to penetrate that egg, the payload of the egg and the sperm, they end up coming together, they unite. So in other words, what do we have? 23, 46 chromosomes coming together. Now this egg, this ovum is fertilized. We can say that it is a diploid cell. And the term for this diploid fertilized egg is a zygote. Okay, zygote. So what is a zygote? A zygote is when the DNA from the sperm and the DNA from the egg come together, right? When both DNAs come together, that is what we called a zygote. About a week later, that zygote ends up coming to the uterus. Okay, 6 to 7 days afterwards, it will arrive. Amazing process. So again, when you look at the uterus, it serves as the passageway, not only for sperm, but also eventually for that child as well. Now, women that have already been pregnant and had a baby, it will be larger in them. When hormone levels are low, it will be smaller. Again, or women who never had a baby, it will be smaller in them. Now, when you look at the anatomical, the divisions of the uterus, there is a fundus, there is a body, and then there is an opening, which is called the cervix. Okay, cervix, body, and fundus. We'll try to look at the photographs of this to better understand this. So again, what do we have? The isthmus, the uterine cavity, the internal os, and the vaginal opening, the internal area and the external area. Let's look at these photographs. Ligaments that are holding it in place. All right. There's a broad ligament that holds the uterus in place. Again, they're just, I've told you about this before, the folds of the peritoneum. There is a paired uterosacral ligament. And then there's the lateral cervical ligament. So they're called the cardinal ligaments or lateral, this is the term that I use, lateral cervical ligaments. And there's also this round ligament. Okay, so there's many ligaments you can see over here that are holding this uterus in place. And again, it needs to be very well supported. If you think about it, you're going to have amniotic fluid inside there during pregnancy. There's going to be a fetus growing in there. It can be several kilos, hopefully not that much, but again, it can be more than that. So again, you need strong support for that. And again, ligaments are strong tissue, strong connective tissue. Therefore, ligaments are present. Round ligament, the lateral cervical ligament, the uterosacral ligament, broad ligament, all these will be holding the uterus in position. Now, when you look at the layers of tissue in the uterus, there's the outermost part, the middle part, and the innermost part. The outermost part, this is the perimetrium. The middle part is the myometrium, and then the innermost part, the vascular part, is the endometrium. This is the part that's essentially shedding every month when a woman she has her menses or when she has her period. This is it. This is the endometrium, right? So the stratum, this layer, this strata, it is sawed off during menstruation. The deeper layer, the stratum basalis, this is permanent, and again, it gives rise to the new stratum functionalis. So again, within the endometrium, the stratum functionalis, it lines the cavity of the uterus, and again, this is what ends up being. So when an egg comes there, it's attached there. Nothing happens. That's it, right? It'll go off. Or again, egg does not get fertilized. This is the part that ends up being released, the layer. So again, you know, we talked about prostate cancer in men. So men have to worry about prostate cancer. Women have to worry about cervical cancer. So cervical cancer, and we're talking about cervical cells that end up being mutation takes place. And they end up being, and there's a mutation. Unfortunately, it could be malignant. The malignant mutation. That can end up causing many complications if it's not treated. You know, it can spread. And, you know, some people can die from that. So a lot of times, if it's caught earlier on, it can be treated. Other times, it will spread, and you know, it goes to the uterus. Now you have uterine cancer, and then at that point, a lot of times, a doctor will remove the uterus and ovaries as well. Uterus, ovaries, fallopian tube, everything gets removed. Complete total hysterectomy, and then they end up doing. Okay. What is next? So over here you can see this is the opening of the uterus. That's the cervix. This is the vagina over here. Okay. Vagina, that's cervix. This is the body, right, of the uterus. And then over here you can see heavily, highly vascular, very, very vascularized. And then you can see the different layers. So what do we have? Perimetrium. You have the middle layer, the myometrium, and then you have the innermost layer, the endometrium. The inner lining, endometrium. This is the muscle part, myometrium, and then the outer part, the perimetrium. So the blood vessels, they come through the perimetrium, supply the muscular layer as well as then you end up having the innermost part. So these are the three parts, the three strata for it. And if we start looking closer over here, you can see the endometrium over here. So you end up having the stratum functionalis. As you start moving along outwards, so you go from stratum, this very part over here, the terminal part, this would be this part right around there. Okay, that would be the stratum basalis over here. Okay, you can see the arterioles, the blood supply. You can see the radial arteries as well. Down over here, okay, called that, and it's the spiral arterioles all the way over there. It's kind of like spiral around, spiral arterioles. Okay, what else? All right, so the moving along to the vagina now, right? So when you move along to the vagina, again, this is a long fibrous fibromuscular canal, and what is it lined with? Again, mucous membrane. The vagina, not only its main purpose is in the role of reproduction. So it is will be the structure in females that will receive the penis during intercourse, and the vagina also is the reproductive structure that allows the discharge of menstrual flow, and this is also the structure that will allow as a passageway for the fetus to exit the womb, the uterus, during childbirth. Okay, these are all the roles for the vagina. If you look at the vagina under the microscope, the tissue that's there, histologically speaking, it's made up of epithelial tissue. It's non-keratinized, stratified squamous epithelium, along with the lamina propria, which ends up lining what's referred to as the rugae folds over there. There's also dendritic cells that are present, and as well as antigen-presenting cells. Again, they have more of an immunoprotective function to it, component to it. As we move along, so again, here's the histology. Again, you can see the lumen of the vagina. You can see the mucosa. Again, these are just all you can see them right there. These are non-keratinized stratified squamous epithelial cells. That's a lamina propria over here. Lamina propria. Then what do we have below that? This is all muscle tissue, the muscularis. So again, you have there's an inner part, the circle layer, and then there's the outer part, longitudinal layer. So again, it's the alternation of, again, the circular as well as longitudinal that ends up providing, well, kind of think of them as like contractions as well. Again, one thing is it facilitates the flow of substances, right? And again, especially childbirth, it helps as well with that. But it's uterine contraction as well, in terms of expelling the child out of the womb. All right. When you move on to the external genitalia, the vulva, there's the mons pubis, the labia majora, labia minora, and then there's the clitoris. Okay. So if you look over here in this photograph, essentially this is what you have over is the labia majora, then there's the labia minora, okay? The minora majora. There is the vaginal orifice, okay? Vaginal orifice, and then this is the external urethral orifice over here. External urethral orifice. So baby comes out from here, urine comes out from here. This is part of the birthing canal. Again, it's separate in women, not like male. This is the clitoris over here. Clitoris, this is the same structure. You know, its homologue in males would be, anybody? Who knows? Let's see. Does anybody know? Glory.
Yes, sir. It's homologous to the penile.
Yes.
Penile urethra.
Very good. So again, the homologue would be the penis, okay, in males. This clitoris essentially is the exact same thing as a penis in males. And we know this, again, study, this is the structure, but also sometimes what ends up happening is some women or some females, they have a very, very enlarged clitoris, which kind of looks like a penis. This happens sometimes, okay? Development is not perfect, it's imperfect under certain conditions. Whatever reason, sometimes some things go wrong. You can see this structure, its end results when it's enlarged. So again, it's similar to, it's homologous to the penis. Okay. What's more? The urogenital triangle, and the, okay, yes. All right, so when it comes to this part over here, so this is that urogenital triangle when you look over here. Urogenital triangle. You may actually see it's kind of like a triangle, all right? Now, as we saw over here, so what could happen is this anal triangle, urogenital triangle, during childbirth, naturally it should tear, it should rip. Okay. Now this is better for that to happen than for a doctor to have to cut it. Now, why does that need to take place? So the baby can come out. So birthing is a nasty process. It's disgusting. There's nothing beautiful about it. Some people think it's beautiful. No, not really. A lot of bleeding. There's feces that comes out. And the child is crying. The woman is screaming. It smells bad. There's nothing beautiful about it. Even the baby, when it comes out, doesn't look beautiful. I told you guys before, it's just the hormones that makes you love that baby, right? Essentially, that's all it is. It's again, it's deliberate. It's designed that way for that hormone to get released. That has that purpose of uh, you know, eliciting desires of love for this organism that causes suffering for 9 months, and then the worst pain during the birthing process. Then all of a sudden you love it. It's hormones. If not, you'd kill something else from your body if that was there. So again, it's been designed this way. It's been created. You can create it like that. So yeah, when I told you, sometimes the doctor they'll end up cutting. That's called an episiotomy. Episiotomy. This is when they'll cut so the baby can come out a little bit easier for childbirth. Now, what ends up happening after that? What do we have left? Well, you got that baby that came out, you given birth. It's crying. It's hungry. It needs to be fed. So the structures that the woman has, female has, to sustain that child that she's given birth to are the breast. Okay, so we look at mammary glands. And the breast, this is the projection, is anterior to the pectoralis major, as well as the serratus anterior muscle, and it's attached by a layer of fascia. It's made up of dense, irregular connective tissue. Along with that, you end up having nipple that's there. Nipple that's consists of many ducts, and these are called the lactiferous ducts, where the milk ends up coming out from. Now the areola, they're just modified oil glands, modified sebaceous glands, and again, what part of them, there is a natural lubricant that's around them also, that's there, and again, part of that, it helps so the nipple does not end up chafing, it doesn't dry up, keeps it moist. Otherwise, again, breastfeeding is very difficult also. I don't know, those of you that may have had children, those of you women, you know that it's not an easy task, it's a very difficult task. So, this is the process of it, it's part of that. You have a connective tissue called the suspensory ligaments of the breast that run between the skin and the fascia, and they help support the breast. What else? Yes, so again, women, they also need to be concerned about breast cancer. So breast cancer, again, cervical cancer, breast cancer. So every year, women should be having, I don't know, in Europe, it's different. In the United States, it's a little bit different. I have no idea what it is in Asia. But here, let me say this. At least once a year, they say in the United States, for women to go and get a mammogram, okay, or again, even a breast exam by a doctor, or every month, women should be examining their breast themselves to make sure that there are not any lumps that are present. The presence of lumps, it would require further investigation by a healthcare professional to rule out the possibility of breast cancer. So it's better to be safe than sorry. Now, with that, what I will say is this. With that, I will say that after you have children, your chances or the chances for a woman to develop breast cancer as well as other reproductive cancer, it significantly decreases. I think by more than 70%, 75%, the chances for a woman to have breast cancer or cervical cancer, it decreases after giving birth. Now, provided that she does not have any history of any venereal diseases for that matter. What would happen to her? Why did it close? Oh, what happened? wonder why that closed up the PowerPoint. No problem, we'll just open it back. It will come back up. All right. Was that the end of the lecture? Maybe that was the last slide. Let me check. Oh, yes. Okay. So not quite. Okay. Yeah. Breast cancer. A few more slides left. So yeah, here you can see again areola. This is the areola. This is the nipple. And you can see these are the glands over here. Okay, that are going to be producing milk. This is all just fat. Okay. Underneath that you have the muscles, pectoralis major muscle. You can see. And then behind that you have lung tissue as well. So again, there's a lot of stuff going on over here. Again, the lungs, of course, that would be behind the costals. So these are all ribs. You can see over here, that's a rib, that's a rib, that's a rib, that's another rib that's cut off. This is muscle over here. This is the intercostal muscles that you find between. Behind that, then you have your lungs over here. It's relatively nice lungs over here. You can see it's nice in color. Okay, so yeah, a lot of fat tissue here, a lot of adipose tissue that's present. You can see that's the nipple, and then around that you have the areola that's present. It's all areola over here, areola. Okay. What else? Will this work? Let's see if this works. Okay, it doesn't work. I guess I don't know why. Apparently, Flash is being retired. So anyway, you can look at it on your own. All right. So when I told you about that cancer, all right, if you don't have any STDs, right, if you can stay away from these, chlamydia, gonorrhea, syphilis, genital herpes, genital warts, if you can stay away from these, then your risk of developing these cancers are significantly less. So again, getting married, having children after marriage with a monogamous partner, I need to add that, that's extremely important, will decrease the risk of cancers in women, reproductive cancer. Why? Because you can't be married to a man who's, sleeping around with multiple partners with women. It's immoral, that's one. But aside from that, when you're promiscuous, you end up getting diseases as well. You're much more likely to when you have multiple sex partners. You can sleeping with 4 or 5 women, a man, for example. One of them has chlamydia. He goes to sleep with somebody else, then he passes that chlamydia to another woman, and then to a third, to fourth, and he gets something else from another one. So now he ends up getting, God knows, chlamydia and gonorrhea, or herpes and gonorrhea, and then he sleeps with his wife, and he ends up passing that to her as well. So she has no idea, thinking that her husband is honest and not doing anything like that, and she doesn't have to worry about that. But that is far from the truth. So yes, it's very important as well. You have to have that. All right. So birth control, there's lots of different methods for birth control. I don't want to get into that too much, but simplistically. The best form of birth control is abstinence. Okay, that's the end of it. Abstinence. You don't have any intercourse, you're not going to get pregnant. That's the end of that. Okay, especially before you're married. Now, after you're married, and you've had children and you don't want any more children, tubal ligation, that's one of them. Both in men and women. Again, in men they have the vasectomy, right? Women, it's the tubal ligation, essentially the same thing. There's also hormonal meds, non-incisional sterilization process. I don't recommend anything. These oral contraceptives are horrible. Ladies, do not take them. They're horrible. They are manipulating your body to do things that it's not naturally intended to do. Stay away from these oral contraceptives. They are horrible, horrible, horrible medications, and they are playing with your body's chemistry. Stay away from that. Do not take them. They're dangerous, and again, they have long-term effects that which still are not very well known, but again, you tend to see them. Now, one of the things I'll tell you very simplistically that's seen in a lot of women that take these birth control pills, they end up having hair loss. They start to bald. All right, so that's one of the issues that can happen. You can actually start to get a lot of hair loss because you're taking these birth control pills. Aside from that, there's intrauterine devices that could be used. Or again, there's spermicidal creams or gels that could be used. There's barrier methods. Also, again, in males, there's condoms as well, female condoms that could be used, male condoms. So these are all devices that are there to prevent pregnancy. Okay, all right, so that is that.